Hello, I am wrapping up my graduate program for a Master's of Social Work, and I am presenting research and experience from my second year advanced generalist social work internship, which was at the Newborn Intensive Care Unit at Tucson Medical Center in Tucson, Arizona. As part of my position, I engaged with many families who had babies that were admitted into the NICU, and I facilitated psychosocial assessments with the mothers of the baby and families. The psychosocial assessments provided an opportunity for me to assess family dynamics, educate mothers and families on support services, explore immediate and future interventions, and provide a referral process for any community resources. However, my main focus throughout my psychosocial assessments was promoting postpartum care for maternal mental health disorders. For my advocacy video, I have compiled research from three organizations: the American College of Obstetricians and Gynecologists, 2020 Mom, and Tucson Medical Center. The American College of Obstetricians and Gynecologists is a nationwide organization that aims to improve women's health through best practice management, advocacy, and education. 2020 Mom is a nonprofit organization that focuses on closing gaps in maternal mental health care through education, advocacy, and collaboration. Tucson Medical Center is one of Southern Arizona's locally governed nonprofit regional hospital, which has amazing women's programs that provide dedicated health care for women's physical and emotional needs. As you can see, there are 1 in 5 women who will suffer from maternal mental health disorders. Perinatal mood and anxiety disorder can not only impact any woman of age, income, race, marital status, or education, but it is also a leading complication of childbirth. Throughout this video, I'm going to talk to you about some of the maternal mental health disorders. As you can see, women can experience what's called baby blues, postpartum depression, pregnancy postpartum anxiety, pregnancy postpartum obsessive compulsive disorder, and pregnancy postpartum post-traumatic stress disorder. Baby blues and postpartum depression will exhibit similar signs and symptoms. However, women who experience postpartum depression will experience intense, overwhelming emotions. As you can see, baby blues impacts about 60 to 80% of new moms, and signs and symptoms start to occur 2 to 3 days after childbirth. However, they will go away on their own around 2 weeks or so after childbirth. Postpartum depression will impact 10 to 20% of women. Most likely 15% of women will have postpartum depression. These signs and symptoms will begin around 1 to 3 weeks post-delivery and can last up to 1 year. Signs and symptoms for baby blues and postpartum depression look very similar, but as I mentioned before, women who experience postpartum depression will experience their emotions at a more intense level. Some of these signs and symptoms include sadness, uncontrollable crying, some anger, anxiety, blame, guilt. Sometimes women's eating and sleeping habits change. Women can tend to isolate themselves from their friends or loved ones. Sometimes women experience uncontrollable negative thoughts. They can be afraid to be alone with their baby, or taking care of their baby can feel very overwhelming. And overall, women are very fatigued and exhausted. These signs and symptoms prevent women's ability to engage in their daily activities and tasks. Aside from baby blues and postpartum depression, additional maternal mental health disorders include, as I mentioned before, pregnancy postpartum anxiety, pregnancy postpartum OCD, and pregnancy postpartum PTSD. As you can see, some of the signs and symptoms of these mental health disorders include nervousness, reoccurring panic attacks for the postpartum anxiety, some repetitive behavior and fearful of thoughts for the OCD, and some flashbacks or avoidance, easily startled for women who are experiencing pregnancy postpartum PTSD. So, what are some of the causes for maternal mental health disorders? Women will experience changes in hormones. Usually, if they have a history of depression or anxiety, they are at more risk of experiencing postpartum depression. um, Unexpected factors in regards to any plans that they had, like their birth plan, can cause some of that anxiety or depression. Social challenges like financial hardship or lack of support system. Breastfeeding challenges that can always be very challenging for women. And if a mom has their baby admitted into a NICU, it's a more stressful environment and they're more apt to experience some of those increased emotional stressors given the environment. So, what are the next steps in addressing the challenges with maternal mental health disorders? The American College of Obstetricians and Gynecologists Organization and Tucson Medical Center participate in utilizing the Edinburgh Postnatal Depression Scale screening tool. The score taken from this screening tool will flag social workers or clinicians to analyze the mother's needs and alerts them regarding the needs for additional education and referral for support services. This screening tool is a 10 self reported questionnaire. It's available in 50 languages and it has its clinical benefits on its own. Following the utilization of the Edinburgh Postnatal Depression Scale screening tool, here are some treatment options recommended by the American College of Obstetricians and Gynecologists in Tucson Medical Center. ACO promotes physicians to engage in completing full mood and emotional well-being assessments. They also recommend medication if that's something that moms are interested in. They also provide individual counseling, encourage moms to go to support groups, and there are warm line phone support options available. TMC also continues to provide continuous education, information, and referral services. And they also have their own postpartum depression support group for women. This support group is very informal and it's a great way for mothers to meet other mothers struggling with postpartum depression and learn that they are not alone throughout this journey. Now that I provided you general information on maternal mental health disorders, I want to talk about advocacy. The 2020 Mom organization provides amazing information on how to be the best advocate for yourself and for your community regarding maternal mental health. The 2020 Mom organization educates how to advocate through four main policy and advocacy opportunities. These are diagnosis and treatment, education and prevention, identification of treatment options, and legal reform. In order to put these opportunities to work, we as a community must put in a national call for action, continue to build these partnerships nationwide, and engage in the ongoing trainings while promoting the need for more maternal mental health support. In the state of Arizona, the House of Representatives passed HCR 2038 bill, which proclaimed that May 2nd as Maternal Mental Health Day in Arizona. This is amazing. Along with advocating to bring more support services for maternal mental health, it's also important, especially as a clinician, to educate and encourage mothers struggling with postpartum depression to engage in self care. The American College of Obstetricians and Gynecologists have provided various ways to optimize postpartum care. For example, monitoring maternal mental health should be an ongoing process pre to post pregnancy. Support begins during the pregnancy. It also occurs during transitions to parenthood and during while women care. Follow-ups need to occur sooner than later, and we as professionals and the community must advocate for policy change in obtaining financial support from insurances so mothers don't have to uh, break down another barrier. If there are still some challenges in getting a mother who is struggling with postpartum depression to engage in support services, One of the best things we as clinicians can do is encourage mothers to participate in self help activities. Let's continue to remind them to exercise to help clear their minds from any overwhelming thoughts. Let's help educate them that accepting help is okay. Let's also teach them how to communicate not only with their support system, but to learn how to speak up for themselves. Let's also remind them about living a healthy lifestyle, balancing out healthy eating habits, and getting the proper rest that they need. Wrapping up my advocacy video, if there are any mamas out there watching, or you know someone who is struggling with postpartum depression and needs support, tell them to act now. There are so many supports out there in the community, but if we continue to speak up for ourselves and for one another, think of the impact we can have. To the mamas who are struggling, you are strong enough, even if you don't feel it right now, I promise you. You are strong enough. We are here to help, and we need you to help bring awareness. Thank you.